I can't believe we're going to actually start on time. This is terrific. Into a packed room. Thank you all for doing such a great job of getting in here on time and allowing us to start this this exciting panel on time. My name is Stephen Krein, and I am the co-founder of an organization called StartUp Health, which is on a 10-year mission to transform healthcare by helping 1,000 entrepreneurs build their businesses. And we're doing that through a couple of pretty big initiatives that we launched or started talking about 18 months ago. And earlier this year, we launched in earnest the StartUp Health Academy, which is a 3-year program for digital health and wellness entrepreneurs where they spend several years working in collaborative peer groups, meeting every 90 days together and collaborating with not only other entrepreneurs but companies and investors and experts to help them build their business. The second part of our vision came together a month ago, actually, at the Health 2.0 Summit, where, ironically enough, we became, I think, our first time Health and Matthew Holt in the audience? Yes, Health 2. What's that? Oh, it's a conference, the Health 2.0 conference. And we launched the StartUp Health Network. And the network is really designed to help us bring together all the stakeholders in this sector, not only the entrepreneurs, but the investors and the companies and the government agencies, so that we can all begin collaborating together to find out who the decision makers are at organizations and who the right investors are and who the startups are. And so the StartUp Health Network is something that everybody here and everybody inside of the sector is invited to take the pledge at startuphealth.net to apply. And one of the things that I think is most interesting about the StartUp Health Network is that it ties together all of the fundings that have taken place in our sector over the past several years. And there's a couple of data points that I want to point out. And the StartUp Health Network Insights report, which is curated by Brian, who is somewhere in the audience here today, although I don't see him, is really pointed out something very astonishing. And the numbers are this. In 2010, there were 61 digital health and wellness startups funded for $541 million. In 2011, that number more than doubled to 129 startups with $1.4 billion. And I want you to pay attention to this next point, because so far in 2012, it doubled again in terms of startups, but not in terms of funding. And we're going to talk about that today, because there have been 256 startups funded so far in 2012 to the tune of $1.6 billion. So that's almost or a little more than $3.5 billion since 2010. But as I want to point out, it wasn't the amount of funding that's doubled necessarily, but the number of startups. So it's obviously pointing to the fact that in many cases you can still do a lot with less than ever before. So we've hand-selected today's panel to be representative of two different parts of the ecosystem that we think are critical for the collaboration and the ultimate transformation of healthcare. We've got two entrepreneurs who I believe are blazing new paths in the mobile health space, or just the health space, and two, I hate to call them executives, but two transformers from large companies that you probably wouldn't have seen at tech conferences a couple of years ago. Although Aetna a few years ago started making a lot of noise, I believe it's really recently that Pfizer has showed up to the table to begin collaborating with startups as well. And so we're going to have a series of questions that I'm going to ask the panelists after a brief introduction from each of them, and then we're going to open it up to a pretty lengthy Q&A. I'm asking everybody in the audience. By the way, there's plenty of seats up here for those of you standing in the back. I'm going to open up to Q&A and allow people to ask them the questions. So without further ado, I'm going to ask Inder to start off with an introduction not only about himself and what he's doing, but most importantly why he is focused on transforming the health and wellness space.
Steve, thanks.
Try it.
Can you guys hear me?
Keep talking. That's okay.
Can you guys hear me now? Okay, much better. Great. Thanks. I'm Inder Singh. I'm the founder and CEO of Transform Health. We're incredibly excited about what we're doing. I'll talk at a very high level about our mission and tell you a little bit about my background. We are creating the world's first real-time map of human health. Let me let you absorb that for a second. The idea behind it is that individuals at the first sign or symptom will be able to take action and know better what they should be doing. Physicians will have a diagnostic context in which to operate. And perhaps most importantly, at a societal level, we will have the world's first tool to track in real time the spread of disease and potentially enable population-level health interventions to stop it. So that's the audacious goal that we have. We haven't announced our first set of products, so I have to talk at a high level about them. Our first products, are using both hardware and software to attack the problem. And our first products are hardware products that are smartphone-enabled medical devices. We'll be making them available at extremely low cost or free to consumers, and that will be the first set of products that will allow us to build towards our vision. Prior to my time at Transform Health, I had the great pleasure of leading a major part of President Clinton's international health program. Some of you may be familiar with the work he's done on AIDS and malaria overseas, the deals he's negotiated on the reduced pricing of drugs. That was me and my team over the last 5 years. I am here at Transform Health because I truly believe that if we attack this problem, we can literally transform healthcare globally and enable healthcare interventions like have never been seen since the advent of the vaccine. Thanks.
Perfect. Thanks, Inder. Wendy.
Sorry.
Good afternoon. My name is Wendy Mayer, and I am the Vice President of Worldwide Innovation at Pfizer. And whenever I tell people that, I get the response of, oh, that sounds really cool, but I haven't a clue what you do. So to tell you a little bit more about the innovation team, our purpose within the organization is to accelerate innovation within Pfizer beyond drug development, which has clearly been a very big focus of our organization for some time. But as Steve mentioned, there's increasing pressure on cost within our organization, and for us, too, to be effective with less funding going forward. And with the healthcare environment changing around us, it's become critically important that our organization seeks new and creative ways of connecting with our customers and our patients. And that really is the mandate of my team. And so we focus in a number of areas. One is to drive innovation platforms, which are areas that have a great deal of importance across our organization, but because it's relevant in many parts of our organization, there doesn't tend to be an owner within. And so we incubate some of those ideas, advance them along to a point at which they could be released within the organization. Our focus for 2012 has been digital and developing a digital strategy for the organization. We also work on developing innovative capabilities within the organization, helping people think differently, providing tools and resources that get us out of our box and traditional mode of thinking. And then the final area, which is probably the area of most interest and relevance to all of you, is that through forums such as this, we reach out to the external community, the entrepreneur community, the startup community, and try to make some of the connections that we feel would be most relevant to the initiatives that we're trying to forward within the organization.
Perfect. Thanks, Wendy. Samer.
Hi, everybody. My name is Samer Hamada. So I'm the founder and CEO of a company called Zeal.com, and we incorporated in late 2010 and alpha launched a site in spring 2011. This panel is particularly relevant. We're helping consumers book health and wellness appointments primarily with complementary and alternative medicine practitioners, and those are acupuncturists, chiropractors, massage therapists, and the like. And what's been interesting since we alpha launched in 2011 is that we've learned a lot about, obviously, tens of thousands of appointment requests on our system. And we haven't really announced much either, although Steve knows a little bit from our StartUp Health network that we are in late January going pretty much all mobile and really focusing on the kinds of appointments that it turns out the vast majority of our consumers are requesting, which is sort of real-time, same day. So the mobile network's ability for push notification and texting helps you to do that, whereas the desktop doesn't. the ability to find some practitioner that's near you, so the GPS capability on the phone. And anyway, we're very excited about that, and when I could talk a little bit more about it on this panel. And in terms of my background, I've been part of dozens of startups since 1996, and sold some successfully, invested in some successfully, some went to zero, but typical sort of life of an entrepreneur. And I don't have a healthcare or health and wellness background, so I attacked Zeal from a B2C perspective, which has pretty much been all of my startups. So it's been very interesting and challenging to deal with insurers and other related healthcare companies and government regulation. And I always like to joke that if I'd known what I was getting into, I probably would have started Zeal. But I'm glad I didn't know what I was getting into.
Forgot to wear my black hat, my insurance black hat. I forgot to wear it today. Martha Wofford. I'm, let's see if I can get this down a little bit. I'm head of CarePass at Aetna, and hopefully some of you heard Mark Bertolini this morning talk about it quite a bit. So for those who didn't, it's an open digital platform that supports mobile apps with the intent of making healthcare more convenient. So the kinds of things that Sam talked about with Zeal, how to make appointments easier for all of us to get when we need to engage in the healthcare system. Really focused on simple, easy-to-use solutions. We've seen a lot of robust solutions that we in the payer space have built and that people don't use because they're hard to find. And so how do you deliver to people tools that they will really use when they're in the doctor's office or in the middle of their daily lives so that they can actually make the best decisions for themselves and their families? And, probably the biggest driver of why we're doing this, you heard a little bit from Mark this morning, which is healthcare costs. And so we look at costs being completely out of control in the healthcare system and really looking ahead to the challenges that poses for our country. And so we think that mobile and a whole host and an array of different types of solutions will be really important to engage people better in their health if we're going to have any hope at attacking some of the core drivers that are pushing our health costs higher. So we're really looking at wellness solutions to help people engage, as well as tools to let people better understand the conditions they're facing and access care.
Excellent. Before we dig in, I want to let people know there's plenty of seats up here. There's a lot of people standing in the back. So I'll give you guys a few seconds to kind of come up and settle in. And this is a 2.5-hour, 3-hour panel, so you guys might want to sit down. I'm only kidding. It's an hour and 15 minutes. All right, so while everyone's taking seats, I want to get a show of hands. How many people in this room are entrepreneurs right now? Keep your hands up high. There you go. Okay. Did you count that, Inder? Okay. Nice percentage. How many people in the room want to be an entrepreneur? Actually thinking about starting. Hey. How many of the people in the room are investors? Actually, active investors in health tech startups. Can you guys stand up, please? No, I'm serious. Can you guys stand up? Right, exactly. I really did want you to stand up because this is it. Okay, don't applaud them. Yeah, they didn't give you money. But here's the thing. We did a roundtable here last year, and I asked the same question. There were 3 people in the room. So I think it quadrupled or more since last year. This is fantastic that investors are now showing up to the party. How many people here are part of big companies? Executives from major corporations? And how about government? Anybody here in the government? Okay, last question. Doctors or other healthcare professionals? Love that too. Showing up to the party. Okay, great show of hands. I wanted you guys now to know who you're talking to a little bit too. So one of the things I mentioned in my opening was that there's been a doubling of startups being funded every year, but not a doubling of funding numbers total, which some might look at differently than we do. We at Startup Health know through the dozens of entrepreneurs in our program and the hundreds of companies that applied that there's a lot of people getting in the game now, and the costs of getting in the game are much lower than ever before, which means experimentation. And experimentation and learning and data collection that literally even 18 months ago or 3 or 4 years ago would have been unimaginable. And Samer, although he says he's not from the healthcare space, he spent the past 18 months or 24 months deep within it, learning a lot. Learning probably more than most of you in this room who have not been working on digital health and wellness startups, because he's in the game. And like Aetna, a few years ago, started showing up and talking to at tech conferences and being very present. They're in the game. And so my question is, how much of this that we're now embarking on I hate mobile health, but around this idea of the transformation of health is about perfecting your entry in, or just getting in and getting started to start learning? And I want to start with Samer and then touch on that with Martha.
I mean, in some ways what you're talking about is just endemic of all startups, right? You just want to get in the game and start working.
But by the way, but not endemic of the healthcare industry.
Right. So as I say, the one issue with healthcare, though, is that there are a lot of regulations and a lot of other issues you have to deal with, and you can't just necessarily jump right in. I was talking to a Forbes reporter a couple months ago, and she wanted to write a story about, Zeal and what we were doing, and we had just gotten some coverage in the Huffington Post. So she said, well, I want to write about something else. So, what should I write about? And I said, well, you could write about why starting a digital health company is so effing hard. And she's like, what do you mean by that? So anyway, you might have seen the story in Forbes. That was just one part of it. She talked to a number of entrepreneurs, but we all said the same thing, which is that you have to figure out the regulations, fee splitting and corporate practice of medicine and referral fees and all these issues that you don't have to deal with a lot of startups. So that costs some money. And there's HIPAA. Well, what is HIPAA? It's pretty complex, it turns out, and yet it's not, but it is. It's very hard to understand, and even I don't understand it that much, and we spent many thousands of dollars trying to understand HIPAA. And on and on. So you do have to actually plan a little bit and think about what you're doing and go talk to people. I find more so than I have at a bunch of other startups, where you can put up a page on the web or do some A/B testing or create a simple mobile app and phone gap and just have people try it out. You just can't quite do that in healthcare. So I don't know if that answered your question, but I did jump in. We did a lot of planning. We spent a lot of money on legal and regulatory, and then we were able to get started. And then we learned that what we were doing wasn't quite working.
That's actually what I wanted to touch on.
Yeah.
Is that you got in and you experimented and you learned, and you're for in the tech world it's called a pivot.
Yeah.
But you're adjusting your business plan in real time with, compared to 10 years ago, a very minuscule amount of money.
Right.
But I wanted to just touch on that and then I'll move over to Martha on that. But
so more specifically with
Yeah.
us, part of why this panel is relevant is the pivot we're involved in. We've seen in the last 18 months that we've gone from about 5% of our audience accessing our service through mobile, and this last month it was 31%. And half of it's the iPhone, by the way, which is probably a whole other discussion. And then when we started using our own service on mobile, we realized it just doesn't work. And then we started digging into the data, and we now have literally like 16,000 appointments that we've dealt with in the past 18 months. And seeing what people were trying to do, we realized why mobile was so important, and it's what I alluded to in the opening. People were looking via GPS, sort of, who is near me and where can I go? And then they were also asking us to get them an appointment. This was 62% of the time, the same day. So like, the desktop doesn't work. The mobile will work for what people are looking for, which is why we're going all mobile. And I joke with our board and our team that we might just destroy the entire website in a few months and not even have it. That doesn't mean it won't be an entry point to get the app or maybe to learn more about the service, but I'm not sure we're going to have a desktop product in a few months as a result of all the data that we collected and after learning what people actually want in this space.
excellent. Martha?
Yeah, for us it's been really interesting. We have the privilege to work for a CEO who is really truly an innovator, and so he took us aside and said, I don't want you to go away and plan this for a year and build out all the specs and then go and build and bring me something in 2 years. I want something now. And I know it's not going to be perfect, but you're going to be able to iterate. And we're going to put it out live, and then we're going to keep going. And it's not what we typically do, but we're going to be okay with that as an approach. The other thing we did is we looked in the mirror and said, we're really not the most innovative entity on earth. I know it's hard to believe that a 160-plus-year-old insurance company isn't the most innovative. But no, we really did realize that and said, oh, what can we do to look at the world differently. And so we thought about multiple execution paths as we thought about the consumer's healthcare journey, everything from getting information to getting care to staying well and staying out of the healthcare system. And we looked out in the market, and we really liked iTriage, so we actually went through the process to acquire it. And then we built simultaneously the CarePass platform to house a set of apps, and also importantly to house developers to create new apps, so to open up our data and services through APIs to create a place that navigates some of the challenges that Summer just talked about with the healthcare space and make it easier for developers to create new innovative solutions. And now we're partnering with market-leading apps that are out there to bring them to our members, our 18, soon to be 23 million members, but also consumers more broadly beyond Aetna membership, to bring what we think are the best solutions out there together. So really looking at it broadly across all different paths so that we can bring in some of that great talent that's out there and great solutions.
So getting in the game quickly and start learning as you go.
Absolutely. This is such a rapidly changing dynamic market that if you think you know everything and you go out there with the perfect solution, it will be out of date quickly, and you're going to have to keep on a rapid, iterative process.
So shifting gears a little bit for Wendy and Inder, I want to talk a little bit about translating that into planning, because I feel like compared to the two of them, you're just getting ready to launch your first product. You're now just getting focused on it, but you're really showing up and coming in much more aggressively than you had previously. Now that you get, and a lot of people both watch Aetna today as an innovative company in this space, as with Mark's leadership been able to change people's view, at least in our sector, about Aetna's role. But for Pfizer and for Transform Health, what does that mean in your current planning stages? What does 2013 look like for a big company and a startup, trying to plan but not overplan, trying to figure it out but not spend too much time figuring it out?
I'll start. I think for us, we really are in a position of needing to learn how to work with startups. So as an organization, we typically are we can be very buttoned up in terms of business case for investment and wanting to see a proven ROI that something's going to work and that all of the T's are crossed and I's are dotted before we're willing to invest and jump in. And I think we're beginning to realize that that there's a lot going on in the marketplace, and trying to get more involved in the incubators, getting more involved in the entrepreneurial community to understand what's happening. I think a big challenge for us going forward is that given that we don't have this experience, it's a little bit overwhelming. And so to try to figure out how to connect with the right people, how to get involved at the right time, I think the point that was made earlier about getting started, we are trying to work with people that are still in the formation stage of the business and having the opportunity to partner with them so that we could use our information and understanding of the market as part of their input as they look to develop their offering, and so that it delivers upon what they see as the big opportunity in the marketplace, but is also connected to what we see and understand as big needs within the marketplace. But there's still a lot for us to learn, and so for us, 2013, I think, is still about the experimentation, trying to see how we can get involved at an earlier stage of development with companies and what sort of expectations we can set we could work with our management so that their expectations are level set around what's going to come of this and what can be realistically achieved in the near term.
So we're going to dig into how to actually, if you're a startup, how you actually can approach Pfizer in a few minutes. But Inder?
Yeah, we're just getting started. So we closed our seed round of financing a couple months ago, and we are in the thick of it. And I think the biggest challenge, and this is probably a reflection of what the other entrepreneurs in this audience are facing, is how do you test the market? How do you test the market, particularly in this highly regulated nature? I mean, this very much reflects what Samar was talking about. For us, we have an additional hurdle beyond the traditional, I don't know if it's an additional hurdle, but beyond HIPAA and some of the general regulations, we have to go through FDA. We have a medical device. And so trying to figure out, a lot of the time we've spent up front is regulatory strategy. What do we get approved first? second, third, and how do we sequence those activities in a way where we can actually test the market, and what can we do before we even get approval to test the market. So there's a lot of strategic thinking that's required and a lot of input from advisors. As an early stage company, I think the other challenge that we're facing is that for health tech companies, for mobile health companies, you fall at this very interesting intersection, particularly if you're consumer facing, of consumer tech and healthcare. And finding talent and aligning talent with the right skill sets is hard. I mean, sometimes you want people with very strong healthcare backgrounds. Sometimes you want people who have zero healthcare backgrounds and approach this from a consumer tech perspective. They understand how to create beautiful, elegant, wonderful consumer mobile or other consumer experiences. And I think aligning your hiring plan against what's available in the market in terms of people's backgrounds can be a challenging thing. And so that is one element of trying to get started quickly, is trying to figure out where you're going to pull the talent in. So that's what we're wrestling with. And, you know, we also don't want to get stuck in analysis paralysis and really just move quickly. But testing the market is the biggest challenge, I think, figuring out how to do that.
So everyone always talks about how to figure out how to work with big companies, or you see these panels where venture capitalists get up and tell you how to work with them. You know, call a friend of a friend who knows somebody there. I want to ask Inder and Samer, for the executives out there, and specifically to them and maybe even the people on the panel, how do you think you work with startups? How should big companies think about working with entrepreneurs and startups? Because I am 100% positive that for the majority of large companies out there, they have a feeling that it's going to be their rules, which will tell entrepreneurs how to work with them. However, and I'm going back to the funding data in the beginning, entrepreneurs are raising small amounts of money from angels. Sometimes corporate VCs are getting involved, but many times they don't need to be. And I think more and more, there are many more startups who have the ability to say, do I want to work with Aetna, United, WellPoint, Humana? I want to go, which one's going to be the most open to working with us? So let's flip it around. What's the best way for these big companies to entice you to work with them? Samer, you want to start? What's the best way for a large company to want to or to work with a startup or an entrepreneur like yourself?
Oh, boy. I knew you were going to ask a question similar to that, and I thought I was going to come in and say, you know, set up an office of innovation and do all this. I'm actually just sitting here thinking about it. Maybe this is controversial, but I don't think you should. Not right away, at least. And the reason is because I'm just thinking of all the startups I've been part of, we frequently go too early to the big companies, and we're not quite ready to work with them. We don't have enough data. We don't have enough traction. I think we just waste a lot of time talking to big companies when we should be just, like Inder was saying, just get the product out there, start testing it, start figuring out, you know, how the marketplace works. So I think the answer is you've got to wait. You know, meet them at the Startup Health networking events and, you know, various accelerators and this and that. And I've had the privilege of meeting these two people. That is shameless, right? But I think you have to wait. I really do. It's important to get traction first and, in a way, have them call you because they start hearing about you. You know, like Martha called iTriage and said, we want to work with you guys.
Inder.
Yeah. So in my prior life, I did a lot of work in partnering with big companies, and we've had some success early on in starting the conversation. I agree with Samer in general. It takes a long time to navigate a big company. Big companies are kind of like governments. You got to spend your time, and you got to figure out who the right decision maker is, which is not always apparent even to the people inside the company, oftentimes. And you've got to figure out which budget you're getting access to if you want them to be spending any money whatsoever. And that's not always easy to do. But I do think it's about meeting people at conferences, building the relationship, sharing a vision, understanding where their priorities are and how you line up against their priorities, and understanding in particular who the decision makers are within those particular priorities at those companies, and making sure you get access to those people quickly. Don't waste your time with someone who's not a decision maker. For all the other entrepreneurs in the audience, don't waste your time. Find out who the decision maker is and develop a relationship with that person within the company. So, yeah.
So I want to use that. as the foundation for, two questions to both Martha and Wendy. One is, if entrepreneurs are hesitant to show up at your door unprepared or too early, yet you want to be early and you want to get to know what's going on, what is the best way to begin working with your organizations or perhaps similar organizations like yourself where there's tens of thousands, if not over 100,000 employees, and the different doors that people could go in could get them a no, even though it actually didn't need to be a no if they went to the right place. But want to...
I think one of the things about entrepreneurs and startups is it's not a monolithic group, right? So if people have really done their work and they have a solution that actually has measurable outcomes and they can prove the persistency of the app, that's a very different conversation for us to have with our healthcare management folks about our ability to really sort of bend the cost curve. And so that's a discussion we would love to have. And if we have something that's new and innovative and out there, we would love to get on it as quickly as possible. What we see a lot are companies who have an idea. And a lot of times it's hard to tell what's an idea and what's a PowerPoint slide and what's actually a solution. And so you spend time just trying to navigate where they really are. So it does take time. It takes their time, takes our time. We have a whole new area of Aetna that's focused on incubation. And so I think that's another approach, and it may be like what you do, Wendy, on the innovation side, where we're actually innovating business internally and also looking for different startups outside that we can help incubate. So I think there's ways to do that we can start earlier on than what we need to when we look at just purely from a payer perspective and the outcomes that we need to be able to have a proven ROI.
So I have to ask, because you said incubation, are you building companies inside of Aetna?
We are.
And so if a startup is coming to Aetna, which is this great CarePass API, which seems very open to being able to plug right in, probably within a matter of weeks versus months or years, in the old world, should entrepreneurs be fearful of bringing those ideas or those things into Aetna if you're also building?
Well, I think it's a path for them to distribution, right? So developer.carepass.com, you can come and offer your solution to all of our membership. So that's a way for them to grow and to scale that I don't think is easily available in the market. Also, we'll have the opportunity for developers to put, if they have a service that they want to make more broadly available, out there for other developers to actually use with a revenue share opportunity. I mean, the big challenge that I hear from the people that I talk with in the startup community is how are we going to make money at this? Like, what's the exit strategy? How's this really going to work? And so I think what we provide through CarePass is a way to really test the solution and get more familiar with that organization. But I don't think it's a threat. I mean, we're out there doing different things, maybe heavier weight from the background we come from than many of it. Maybe not. Your solution sounds a little bit on the heavier side, but I think what we can see startups do is come at it with that fresh consumer perspective where we get bogged down in all the pieces of the healthcare industry. So I think we're coming at it from different spaces, so don't see it as competitive.
Does everybody know what an API is? Raise your hand if you don't. I mean, I really just want to see if we have to address that. Don't know what an API is, because I think, can you, just for 2 seconds, so we don't bore the people who do know.
It's an application programming interface. It's an open interface to access data is the easiest way to explain it.
One of the big benefits of APIs, especially in healthcare, is this notion that it's a standard way of working with Aetna. For this platform, they've kind of come up and said, here's the way you can plug into our membership. The contract's the same. The developer interface is the same. A lot of it is standardized, so you don't need to spend months and months and months wrangling with Aetna to figure out the agreement. There's an easy way, entree point, if you will, to working with your company.
Yeah, that's right. We've actually worked with HHS to take some of their data as well and put APIs over it because they've opened up a lot of data, but it's actually challenging to find and it's not in a consistent format. And so we've actually worked with them as well to create APIs over some of theirs so people could actually do mashups around the HHS data and the Aetna data, as well as some of these other startups who have really a service that's pretty neat that they want to make available.
So from beginning to actually being up on the CarePass platform, what's the shortest period of time you've seen so far from the startups that are in there?
Oh, we did a codathon at Health 2.0 hosted by Mashery, and they did it within the time of the 2-day codathon. They did the full integration.
And besides that, what's a typical few weeks getting up?
No, it really can be a couple full days if we have the right. We'll actually sometimes provide some support to help do that if people need it. So it's pretty quick.
Excellent. Wendy?
So I would say that part of what I see as part of the challenge that I think people face with interacting with or finding the right folks within Pfizer to connect with is that very often people aren't clear on where their offering can provide value to our organization. And I find that the people who do understand that best, they may not know the specific people of who to connect with, but they understand what part of the business they might want to connect with. So I have an offering that's related to medical information, or I have an offering that is a consumer interface for a particular product. So those types of things, understanding the value of your particular offering within the frame of our business is critically important to getting to the right group of people in some way, shape, or form. And I would even argue that the specific person is probably not as important because people change so frequently across the organization. But we do have an external partnering interface within the Pfizer.com website, and so people who have an idea or a potential opportunity, and it could really be anything, people submit product ideas.
Yeah, but what's the real front door to Aetna? Your email address? I mean, Pfizer.
To Pfizer.
Sorry, Pfizer.
My email address?
Yeah, or your email. I mean, let's be. I mean, here's the reality, because I think it's one of these things that comes up often. Like, what's the right door to go in? We talked on the phone about this, Martha. It was like, entrepreneurs in the audience want to work with Aetna or Pfizer. Who's the person to call or email to get a response to help them navigate these mammoth organizations, even getting to know them?
I think it's, so my group does filter a lot of the information requests. But again, it's very challenging if somebody comes and we don't have a clear picture. We actually did within my group a few months ago a vendor day as part of our digital project. And so we brought in a number of vendors that many of us had met over the course of our travels at conferences like this and other interaction points. And there were several people who came and presented and didn't really have a clear understanding of what they were offering the value back to Pfizer. And so it was very challenging for us to even say, here's the group that we think you should be aligned with. So as a general initial interaction point, the innovation team is a good place to start. The website is actually a good place. We get a lot of the input gets sent to me, members of my team, other members of our business development group. So that is a point to have your ideas viewed and evaluated by some person. But I would say that it's critically important when you do that you do have a sense so that that person could at least direct you to the group of people or the team that would be able to fully evaluate the value of what you bring to the table and see whether or not there would be potential partnership opportunities.
So I know Inder's got a unique perspective. A perspective and feeling about this. So I wanted to leave with you. Before I do, though, we're going to open up the Q&A in a few minutes. So just if you've got questions, there's 2 microphones in the middle. You can start lining up in about 5 minutes. We'll start doing questions there. But Inder?
So this is really targeted at some of the folks that are in the audience that come from big companies and have significant responsibilities at those big companies. There's nothing I like more than when I get an email. I shouldn't say I like it more, but at least it's clear. I like it when I get an email that says, we're not interested, because then at least I can shut the door and stop sort of navigating that particular area, whether that's government or whether that's a big company. That's a really helpful email, particularly if it's nuanced in a way that says, my business is not interested. I don't know if anyone else is interested or not, but at least you have the information that you can sort of proceed with. We're small flies. Startups are kind of flies on the wall to big companies. So I recognize that writing that email is hard, but for those of you that are working in the innovation space and want to partner with startups, just clarity is very, very helpful. So thank you in advance for any of those emails.
Along those lines, though, Inder, what's your perspective on the role of big company in this? Let's call it a decade of transformation. I think there's a lot of reasons why today we're sitting in. I feel like this is 1995 internet when people are talking about email and people are saying what is that, or web browsing and doing commerce and people are saying you're not going to put credit cards online. for healthcare. This is the beginning of the transformation of healthcare. There's not even a question about it. But there's a role that big companies play in a lot of disruptions. In other sectors, the big players were not the ones that transformed the sector. They were startups that caught the big companies by surprise. However, in this sector, there's a lot of reasons why both the complexity, who pays for the value, who receives the value, who approves the paying of the value, the government's role in it, is completely different. Although, is it? What's your perspective on big companies and their role in this transformation as it relates to startups?
They're hugely important as partners in particular. Let's be honest, whether it's big companies control distribution of services and products in the healthcare space. They control the distribution of those products and services. And if you're trying to go it alone and trying to push at it alone without a business partner, it's hard. You can take examples from biotech, from pharma, from med devices, from services in general. A lot of the small companies go through those larger entities that really understand how to distribute, market, and deal with the regulation. So I think the big companies are hugely important. I am encouraged in one direction by some of those big companies like the two that we have up here on the panel that are really trying to embrace that. But figuring out how to align the incentive of a large company to help you distribute your good and service is damn hard. It's hard. And I think if you find those one or two bites, you stick to them. Perhaps I'll leave my comments at that for now and let, I think, some others on the panel make some comments.
Yeah, I would just say, there's a gap for us. So I think intellectually, we all believe that the innovation is still going to come from the outside, of the big companies. We have such inertia internally that it prevents us, and I think your point about the incentives is a really good one, that it makes it incredibly challenging for us to get to the creative thinking and the new ideas that are really required to do a lot of this transformation. But the challenge is, how do we get from the understanding that it needs to come from the outside to actually, what's the right point in time and how do you partner with the outside to do that? Because that inertia just keeps getting in the way.
Do you have a perspective, Sam?
Sure. No, I completely agree with Inder and Wendy, and it doesn't feel that much different than under other industries that I've been part of with startups. And the true reflection of it ultimately is the M&A that starts to happen, and it's starting to happen in this sector. So as long as there's a steady supply of big companies willing to buy the startups, which there are, I think that we're going to keep seeing a lot of innovation come from the startups.
Yeah, I agree as well. I think one counter is that, big companies do control distribution, but I would say what we've seen with our relationship with iTriage is they're now at 7.58 million downloads, which is far outpaced any tool that we as a payer ever pushed out to our membership. I mean, we have our website, and that's about it that they use at that kind of level. So that's a tremendous number of people. And so I think when you think about direct-to-consumer distribution, I would say that there's startups who may have a better perspective on that than some of the large companies, where we're more B2B companies. And so I think the marriage of that has been very exciting for us to see of how can you take that marketing approach and then push it out to a broader base, like our whole membership base. But I think that we can't, if we think it's all about the big companies and we walk around with dollar signs in our heads and everybody comes and talks to us, we won't then also spur the innovation that we need. So I think to Wendy's point, that gap is really important, and we need a way to have innovators being, driving the bus like they stole it, like just moving even faster than we can do, and then come back together again and see what we can do together. So that's what we're really excited about, is how do you take that innovation and that speed and then try to channel it.
What's the biggest need Pfizer has right now around mobile health or health? The biggest challenge that maybe could be solved by mobile health or mHealth platform?
I mean, there are a number of them, and they cut across different aspects of our business. So whether you're talking about clinical trial or commercialization of some of our products, I mean, I think the big nut that we've had a lot of trouble cracking that I think mHealth presents opportunities is adherence. Adherence has been, the product reminders, and there's a lot more to it in terms of behavioral change and the aspect of what mobile health can potentially do to get under more of the underlying factors that are impacting people's lack of adherence. And I think similarly that can translate to other aspects of, adherence within clinical trials or other aspects of our business. So.
Biggest area, Martha?
Probably transparency. Cost, right? Getting cost information into consumers' hands when they make decisions so that they fully understand what it's going to cost them from an out-of-pocket perspective and the implication to their employer and the costs that they're bearing so that they make decisions to go in-network to get high-quality care, but not to continue to have the healthcare costs spiral out of control like they are. So we think if we can deliver it to them in a mobile way, help them, help their pocketbooks and also help the whole system.
Are you guys investing and acquiring?
Yes.
Yes.
There's parts of it. Now, it's a little complicated. We're complicated, as we've talked about, big companies. But, yeah, part of our emerging business areas is investing.
And Wendy, Pfizer?
We've had some investments in the past. We're open to investments.
Yeah, we're seeing a trend of large corporate venture arms coming down much earlier than they used to, where in the traditional venture world or venture tech investing, there was strategics coming along a lot later, paying up significantly on valuation, but having the companies a lot further along. And I think the lower cost of developing a lot of these startups is making it more enticing for corporate venture arms and partnering to take place where they might not ordinarily have done that. So I think we have our first question at the back microphone. And just your name, what company you're from, what organization you're from, and then the question and who it's directed to.
Excellent. Well, thank you for a very inspiring and exciting panel. My name is Katie Mirage. I work for a nonprofit, actually, not so much in the providing funding space, and called Altarum Institute, and we do health systems research and consulting. A lot of our work focuses on providers and helping providers through health IT to make their practice more efficient, more effective, to improve quality, safety, and cost. And what I've heard throughout the day today, which has been very engaging, has been consumer-focused. Or applications that are connecting consumers and providers more effectively. And what I'd like to hear from the panelists is whether you're seeing, anticipate seeing, or you think we're not going to see provider-focused mobile health applications in the startup realm.
Anybody want to take that?
I can only speak from just my own limited Zeal perspective, but we are building a mobile app for the providers as well. So it's a two-pronged solution. So it's not just the consumer that was having difficulty finding the nearest provider and getting an appointment. It's the providers who are typically in our space, alternative healthcare, they're solo practitioners. They didn't have time during the day to sit in front of a computer, and they don't even have time to answer the phone. But they did have a mobile phone in their pocket, it turns out, while they're performing services, and they just need us to sort of push notifications to them and just notify them of things and show them just simple instructions for what's going on our site and where the demand is for services. So the answer is yes, we are doing that, and we're doing it in a way so they can just very easily see their payments with us, their customers with us, and when their next appointment is. So that's how we're simplifying their practices.
Martha or Inder? Martha?
Oh, I was going to say, iTriage, for example, similarly works for both the physician and the consumer, and I think it's the connection between the two that's really powerful. So what we see in the provider space and those mobile apps typically are about connecting to their EMR in a mobile fashion. So that should be table stakes. But what we want to do is figure out how do we get the right information into the consumer's hands and the physician's hands so that they can have the conversation that they need to have and get the care to the patient in that case that they need. So I think it's not one or the other. I think the providers right now are pretty underwater with meaningful use and all the things that they need to do, just the sort of table stakes. So I think at the moment we're really focused on consumers because mobile is such a consumer tool. It's so personal. We are with we have our phones, when we go to sleep, when we wake up, they're with us. And I think providers are the same way. They're people as well. How do you deliver to them the information they need to make it easy for them to manage their patient population as well?
Did you want to take it or?
Yeah, I would just say, because obviously the provider is a very important customer of ours, and so we've been very focused on provider tools as well, and point-of-care decision support, real-world analytics, using the data and delivering it to physicians at times and when they're making clinical decisions is critically important, and we keep hearing all the time. Somebody was just telling me the other day how nicely the iPad mini fits in a white lab coat, and that should be the staple
There's
for
actually
every physician.
been data. A couple weeks ago, the data came out about the iPad mini now being the favorite tablet in a doctor's office in the hospitals because it's a perfect size for the lab coat. By the way,
Right.
I actually sold my big iPad because the iPad mini is that much better of a small form factor. I want to move. Do you have something?
I was just going to tell a quick personal story that I was getting my physical recently, and I had this weird spot on my arm, and the primary care physician took a photo of it, sent it to the dermatologist. 10 minutes later, we were on the speakerphone. He diagnosed it, and I got a prescription for it. It was really cool.
Yeah,
that was not an app. That's just the iPhone.
Yeah, no, that's actually good. There's actually a company in StartUp with direct dermatology that's.
Was that HIPAA compliant?
So the gentleman in front, you look a lot like this guy Matt Holt, I know, but you got these chops. So could you state your name and the organization you're from for the people who don't know who you are?
I'm Matthew Holt, and my organization is called Health 2.0. Oh, did I say answer the question as well? Actually, I did have an answer to that last question, which is that we've looked at this extensively over the last 5 years, and there's been a tremendous increase in terms of, I don't believe there's a difference between mobile, desktop, interactive TV, on the sensor-based. It's all the same stuff to me, but there's been a huge increase in the kind of cloud-based Web 2.0 type technologies coming onto the provider side exponentially. And even this year, one of the biggest funded companies in that space is Doximity, which is a social network, another attempt at doing another different type of social network for doctors. They're incredibly valuable people, as are all clinicians. And that sort of flips into my next question. Actually, it's for you, Steve. So when you look at startups in this space and the people you're working with, there is the idea that you can do Amazon.com. You can come over, create a completely new company, and do a direct-to-consumer play. And we've seen people toy around with that in healthcare. It hasn't been that successful, but go back to the original WebMD. That was kind of their model. And then, of course, there is the people who are providing services to professionals, in which case you have to work with professionals. So to think about hospitals, doctors, electronic medical record, even a new type. So where is your sense that the market for startups, the ones that you're seeing, is in that space, what's flipping? And would the answers be different on the panel if instead of having Inder and Samir, you had people who are actually, you have Ryan Howard there or someone who's actually aiming directly at the physician market?
There's two trends that we're seeing across the companies in this space that I think are both seeing traction or getting some traction and early feedback and success, not just the ones that are coming in with ideas. And that is the businesses seem to be much more focused on one thing and just doing it better than anybody else. And I hate to, like people talk about ZocDoc, and for all, crazy valuation, they did one thing, and they just spent years and years and years doing that one thing. And everybody knows ZocDoc, which does appointment scheduling, could have done a million different things with that same opportunity. And I think you're seeing that across a lot of different industries. And now in healthcare, we're seeing the unbundling of a lot of ideas into getting focused on the one thing they want to own. And I think the Bob Kocher, who's a Venrock, who spent time at the White House and wrote a lot of the meaningful use part of, healthcare reform, talks about the idea that it's going to be lots of solutions that actually transform healthcare. It's not going to be one company or one strategy or one solution that encompasses everything. It's going to be lots of different things. So we're seeing as many consumer-oriented as we are those that are focused on providers, but I think this is a bottoms-up transformation like every other sector. So you're seeing a small practice at a large hospital start to adopt technology from the bottom up, and we're starting to see people think about not trying to go to the IT department or the CEO and try to get them to buy in to get buy-in down. You're seeing them just try to infiltrate these organizations and these hospitals and these clinics, one doctor or one specialist at a time. And so I know that the data we're seeing around where traction is they start to work with one small, tiny practice at a hospital, never got permission above that. And it's the proof that they're having inside of these smaller parts of the hospital that are driving some of this adoption of innovation up. And so I don't know if that answers your question, Matthew, from our perspective, but it's entrepreneurs focused on trying to focus on one thing they're going to do really well and try to make the decision maker a single person or a small department at these large companies or large hospitals? Do you want to?
No, I agree.
Okay. Hello.
I'm Andy Gaze from Health Tech Capital. I'm one of the 4 investors in the room you asked earlier.
I think you're about 13.
Okay, 13. So one of the questions that hasn't been discussed is the revenue model. And one of the reasons why we like applications that sell to the existing providers is that if you have a value proposition that saves money, it may be painful selling to a hospital there, but there is a way to scale up the business and justify investment. We see still too much on the direct-to-consumer, no revenue models, a lot of that, old days of the eyeballs in the internet days. Let's grab the land and we'll figure it out afterwards. So I'd like the panelists to comment on that, because I think as investors, we see a lot of opportunity, complexity in the providers, a lot of a bubble on the direct-to-consumer, where we'll figure this out later. And some of these early-stage companies raised $40 million are blowing up. The beginning of the bubble is deflating. So I'd like some comments. Thanks.
I mean, I agree with you. I don't invest in businesses that don't have a revenue model. Now, the challenge in the B2C space is you're getting these small transactions from hopefully, millions of consumers, and, it's hard to get their attention. So generally, I agree with you. It's tough in the B2C space. I'm also an EIR at Lightspeed Venture Partners, and we see hundreds of business plans from amazing teams, wonderful ideas, great mobile apps, but they can't get traction. So in the B2C space, whether it's healthcare or something else, just getting in front of the customer at a meaningful sort of cost, a cost that's not too high, is really hard. I mean, when I was doing, Steve, when you and I were doing startups in the 90s, and Google had just come out, you could buy a click for 2 cents, 3 cents, 5 cents, and convert it, and it was great. Now I can't buy clicks for less than 50 to 80 cents, and that's on the low end. And most clicks in healthcare are $5, $7, $11. And you get 2% conversion. Your cost of customer acquisition is way too high. So in general, I agree with you, but you have to like in our case, we're in an industry that's roughly $80 billion in spend, and we're trying to get a cut of every little transaction we can. That's our revenue model. So we have the right revenue model, but the challenge is still getting the consumer and getting it at a CPA that makes sense. So B2B is a bigger dollar, bigger ticket item, but long sales cycles, entrenched bureaucracy. So there's that challenge too. I mean, from an investor perspective, I think both have issues. So I'm not sure B2B is better.
So there's one thing I'll just touch on the B2B, B2C side, which I think is interesting, is that a lot of these healthcare applications can play a role in both customers. So you kind of say, well, who's your primary customer, who's your secondary customer? One receives the value, one pays for the value, kind of like healthcare. And so there's a big thing, even in go back to ZocDoc. I hate to use this simple example of great tool for doctors to fill in the appointments that go unfilled or late cancellations. On the flip side, great tool for consumers to make appointments easily. So there's a lot of people thinking about how providers and patients can play a role in a much more efficient relationship using this technology.
I would just also say from a revenue model standpoint, because a lot of the people that we talk to when we ask them, well, where does the revenue come from? And they said, oh, well, we sell you advertising and you're the revenue. The problem where it typically falls apart is that they don't have any data that demonstrates that what we would be buying is actually wanted by the people that are going to use their offering. And so if that is part of your revenue model, you really need to be able to demonstrate that pharma or whoever it is would have credibility within that space, and that the people that you are going to be attracting to your site would actually come and look at the ad space or the inputs that are being provided.
So I'm pretty passionate about this particular topic because, listen, healthcare is not consumer technology. But there are opportunities to learn from the consumer tech space about the business models that they've used. And I think the fundamental challenge has been that there haven't been enough people in the world that understand both spaces to actually figure out when those business models are appropriate and when they're not. And so, the idea that you can monetize eyeballs, yes, you can. If you have 30 million users of your mobile app, your mobile health app, there are ways to monetize that. You need to be thoughtful about it from the beginning, but there are ways to do that. And I would challenge the healthcare investors in this audience, the traditional healthcare investors in this audience, to be creative and work with your entrepreneurs on this. Because I really believe that there hasn't been enough thought put into the business model of how you apply some of the lessons in consumer tech to the highly regulated, pseudo sort of government, industry that is healthcare, but there certainly are opportunities to do that. I think we and others are trying to advance that cause, but I run up against a brick wall very often with traditional healthcare investors, whereas with health IT investors and with consumer tech investors, it sort of resonates. Maybe it resonates a little too easily with the consumer tech investors, but the point is I think there really are opportunities to think creatively about business model in this space. And I would also argue, the second point that I would argue is that in thinking about B2C versus B2B, my gut tells me that when consumers adopt, the system adopts. And if you can drive consumer adoption of certain types of mobile health technologies, the system will have to follow, whether that's governments or big companies. So it's often a multi-channel strategy if you have a property or asset that's valuable to both the system and to the individual consumers, probably focusing on the consumer. That's our approach, is to focus on the consumer side. That's my gut instinct.
Do you have one business model lesson that you want to bring over from consumer tech? Or you think people should look at, or investors should look at?
I don't have a particular lesson in mind that I think is applicable. I think, the model of trying to opportunistically use the current systems to distribute your goods and services, opportunistically use the current systems to distribute your goods and service is a good one, while you have your primary strategy on something that doesn't rely on big business or big government to distribute it, right? So it's figuring out how to balance that opportunistic use of getting access to customers through the system that I think is important. Boy, that was very ambiguous, but I thought hopefully that's helpful in some way.
Next question.
Hi, I'm Khan Siddiqui. I'm CEO of Higgy, which is a consumer wellness startup based out of Chicago. I just want to reiterate what Inder said, comments about working with large corporations, and it's absolutely crucial that you work with the decision makers. But one of the things is figuring out how your incentives, your mission align with the large corporation mission. And the problem is what you think their mission is usually a year-old mission. What they're thinking about today and what the initiatives are is a very small group of folks, and trying to get to that is a big challenge. We've been successfully able to work with some of them, but it was the most difficult part to figure out. How do you know what their next target initiative is, where you can align with or not? Just a comment. Thanks.
Okay, any other questions out there? Yes.
Bit when you were talking about the need for adherence and kind of that sort of aspect, and then it sort of maybe is slightly contradictory. I guess maybe my question, is it contradictory when you're looking at revenue models and the consideration of health outcomes along kind of these apps, as we're looking more towards moving to preventative care and asking not only are people using them and willing to pay for them, but are they effective? And does that come into consideration when you guys look at investing, and then does it come into consideration when kind of you're looking at creation of these apps?
Martha?
It's absolutely, for us, it's really important. So when we think about wearing the hat of the insurer, we're absolutely focused on trying to deliver high quality care at as low a cost as we can, because we're basically, most of our membership is through large employers, and so we're paid to try to manage those costs. And so we look at outcomes, and we want those solutions to offer them up to those employers, because we think it'll help them manage their employee population and manage their costs year over year, so that they can give people salary increases instead of just giving them the cost today, which goes into their to cover their benefits, or increasingly gets shifted to the employee, which is what we're seeing happen. So it's really important from wearing that hat. What we're doing with CarePass is actually wearing a different hat, which is how do we spur innovation in the space. And so we're looking at it more broadly, where how can we find, we fundamentally think people are very different, and we're going to need a very different set of tools for each person. So I think you get to a view where you start to customize and then personalize the solutions. And so as we think about that for individuals, it's about what will spur them to engage in their health. And so we're much broader about the kinds of solutions that we'd like to bring to bear to the market. But there you don't have the PEPM that we would pay for on the payer side, so you get into the business model question of how do you actually monetize that?
So, two questions. Outcomes or revenue? What would you rather see come to you? If people, I'm bringing this out because, well, it's not. No, outcome. Well, I should say no. It is outcomes. Let me just go. Outcomes that it's working, or a idea of how they're going to generate revenue. Because this is healthcare. This is our lives. This is my mom and dad and our kids and our siblings. I mean, the stakes in this sector, and having with Samer been in another sector for years before being an entrepreneur in this sector, if a coupon startup dies, who cares? If a gaming company dies, oh, that's unfortunate that it's not much fun. We see startups every day come, and they all come from the same thing, an experience they had either in their family or work or someone who has been transformed by this horrible, many times devastating to their family loss, and in their belly believe this solution must make it. They don't know where to go, what to do, how to do it, but they know that whether it's cystic fibrosis, diabetes, cancer, depression, whatever it is, they are passionate that this has to see the light of day. And we can't have investors looking at this going, up, no revenue, no outcome, we're out. We believe it's critically important to collaborate to figure this out because the stakes are high in this sector. Within your organizations and as entrepreneurs, how does that play a role? Making a difference through being able to prove that some of these things can work, or is it all about figuring out the revenue model and how it's going to make money from the beginning?
Well, just to start, I think they're absolutely connected. So in the payer space, that is the model. The business model is about outcomes in many cases, right? So if you can prove that, we'll pay for it, which creates your business model, which lets you attract top talent, which lets you have a going concern. Because we don't actually want to necessarily get the smartest startup if they don't have the full package, if they don't have the talent, they don't have the business model, they're not going to be around in a few years. Because we've educated our membership on it, and then it's not there anymore. That's not helpful for us because we have multi-year sales cycles as well. So we're looking for the business model, I would say, but one channel to that, if it's from the insurance side, is outcomes.
Yeah, so I would say the big investment's not going to come without some potential opportunity for revenue. It's still a business at the end of the day. So as an example, an opportunity that may be a great benefit to healthcare but not be connected to our business isn't going to be something that we are necessarily going to be jumping right in. But that being said, and what I think some of the opportunity is, particularly in the startup space where the investment hurdle is lower, we're also looking at this as a big opportunity to learn. And so from that standpoint, the big revenue, this is going to be the big thing that transforms and helps us make a lot of money, becomes less important at the outset, because I think that there's a lot that we can learn about how the industry is transforming, how consumers are responding to some of these things, how providers are responding. And so for us to get involved, and even if there's a cost to it, it's a cost with a learning benefit. So we're kind of looking at both, but the big dollar investment requires a revenue and workable business model.
Sarah?
You're almost asking, a societal policy question, right? I mean, if we're talking about business, which is what this is, you have to go for a revenue model that works. This is always a challenging one because we're talking about lives, like you said. But yeah, I think you have to have the revenue model first. It just has to be balanced, with the outcomes, like Martha said. I don't know how else to say it, but for me as a startup, if we don't bring revenue and we don't figure out how to get profitable, we're going to die. So we have to do that first, and then if we can prove that our product actually can generate some positive outcomes or save cost, then we'll be sort of doubly rewarded.
I can only speak for us, but for us, they're one and the same. I don't know that many people start healthcare organizations because I hope that not a lot of people start healthcare organizations because they want to make a buck. They probably started because they want to actually have an impact on the world. And the reason we started Transform Health is, and I don't mean to say this flippantly, we want to change the world. And operating in the healthcare space is difficult, but why spend your life doing something that's not challenging and doing something that you don't care about? We're here because we really, truly can make a difference. Revenue is essential to scale, and scaling is essential to impact. So to me, they're the same thing, and your business model should reflect your ultimate goal. For us, it goes back to our core mission of creating the world's first real-time map and using that data in certain ways that have an impact on people. And for us, at least, we've set internal targets around lives saved. It's going to be really hard for us to measure those, but that is at the top of the list of our goals. 10 million lives within 10 years, figure out how to measure it and find the evidence that proves that you've done it. And, you know, I'd suggest that a lot of the entrepreneurs in this audience are probably starting companies for similar reasons. So I don't know. This is a world in which business and social missions collide, and you just need to figure out how to align the incentives for others to help you accomplish it. So anyhow.
Okay, final question. 3 years from now, we're sitting here doing this panel, and we look back over the last 3 years. What has to happen for you to feel happy with your progress? And it can be industry progress or the progress your organization is making. Inder's going to start.
I'll answer the question. We have at least 5 million active users. We figured out how to prove and pilot states that we actually have saved lives. And we're generating significant revenue.
I think I'd like to see that as an organization we're piloting a lot more, that we're partnering with smaller organizations and working collaboratively for both their success as well as ours and the patients and providers that we serve.
You really put us on the spot. Well, I know my Excel spreadsheet says that at the end of 3 years I'll have 200,000 paying customers, so that's my 3-year goal. I mean, probably just for me personally to continue to invest in health companies. That's sort of a new thing for me the last 2 years. I've invested in 3 so far. And just try to find really good teams that are making an impact and give them a little bit of money to get started, a little mentorship, and hopefully make a small difference.
Well, I'll go a little Pollyanna here. I guess that I hope that the efforts we're doing to open up data catch on, and that we see more and more players and the EMR systems of the world and others open up their proprietary systems so that people can get access to their own data, and that we do a really good job of connecting consumers to their doctors. So I think those would be the 2 goals I hope in 3 years we can look back on.
Excellent. So I'm going to ask you to do a one-word close that sums up your feeling about 2013 and this sector. And while you think about that word, I want to just thank everybody for this is a packed room the entire time. Everyone sat and didn't tweet and didn't do email and didn't check websites or anything while this was going on, so I appreciate that. Joking. And signed up for Zeal. But I really want to thank everybody for the questions, for the panelists. And I want to invite everybody because we think it's critical that everybody in this room knows who each other are and this sector knows who each other are. We know who the decision makers are and the investors are and the entrepreneurs are. So everybody's invited. If you go to startuphealth.net to join the Startup Health Network, which lists everybody and has profiles on every company and every investor and every startup in this space. There's about 5 or 6 of us walking around with Startup Health T-shirts, and there's a pavilion downstairs that is called the Startup Health Pavilion with about 20 startups that you can come meet down there as well. So with that, I'd like to ask everybody for a one-word close, and then you can applaud. Inder.
I couldn't use any other word but transform. So.
I have to say I'm optimistic.
Exuberant.
Pumped.